Welcome to this month's edition of Focus on Health. I'm your host, Dr. Barbara Brookmeyer, and today we'll be talking about persons who have both a mood disorder and a substance abuse disorder. And our special guest is Estelle Dupree, a licensed clinical professional counselor with the Frederick County Health Department. Estelle,
Hi.
welcome. Thank you for joining us.
Thank you. It's such a pleasure to be here.
Thank you.
Yes.
Well, I guess the official term is co-occurring disorders.
Yes.
So can you talk a little bit more about that?
Yes, a co-occurring disorder, what we're referring to, is when somebody has a diagnosis of mental health and a separate diagnosis of a substance use disorder. So both those diagnoses, they're both primary. They're two separate conditions, but they also influence and impact each other. Thus, treatment needs to be for both disorders as opposed just for one or the other. In the past, mental health and substance abuse were not very well integrated, so treatment was not effective. So let's per se that you have a family member who has a depressive disorder and they start to drink alcohol and their alcohol use becomes problematic. At that point, I would consider that person to have two separate but primary disorders that impact and influence each other, but each have different symptoms, and they both need to be treated the same.
So what might be different now in terms of how treatment is approached for persons who are thought to have both conditions?
Okay. Well, as I said, in the past, some agencies, and some probably still do, they don't have that integrated level of care. So, for instance, this person we're speaking of would go to the mental health clinic and seek out help, and the mental health staff would say, well, you have depression and you have alcohol abuse, and alcohol is a depressant. So before we can treat your depression, you need to stop drinking. So go see substance abuse, and then get sober, and then come back and see us, and we'll treat the depression. So the person would leave that clinic and go to the substance abuse facility. The substance abuse facility staff would say, you're self-medicating your depression with your alcohol. So you need to get your depression stabilized before we can address the alcohol. So go take care of that and then come back and see us. So this person would receive very mixed messages, and the treatment was not congruent at all. And they may not have been getting proper treatment anywhere because both were not being addressed at the same time.
Wow. Well, is there an estimate of how many people might have both conditions and might have been getting the runaround all these years?
Yeah, the new rule of thumb is that co-occurring disorders are the expectation rather than the exception. For example, in 2010, 9.2 million people were considered to have a co-occurring substance abuse and mental health disorder. Of those people, less than 50% actually received treatment. And of those people that received treatment, only 7.7% received treatment for both their substance abuse and their mental health disorder. And this is alarming when you consider some of the statistics. 43% of youth who are in mental health counseling also are considered to have a substance use disorder. 600,000 veterans last year experienced a co-occurring mental health and substance abuse disorder. Substance abuse is across all ages, just doesn't matter what gender, race, socioeconomic class you are. Mental health disorders, same thing across all parameters. But ages 18 to 25, that population has twice as much percentage of co-occurring disorders as other populations. If we look at Maryland alone, 70%, conservatively, 70% of people in mental health treatment also have a substance use disorder, and 40% of people in substance abuse treatment also have a co-occurring mental health disorder. So when you think of those populations, it really is imperative that we start treating these conditions together.
Wow, wow. So in addition to, I'm interested now in hearing a little bit about some of the problems that people who have co-occurring disorders face beyond just in the past maybe getting the runaround in terms of which condition do they have to get under control or get treatment for first?
Well, people who have co-occurring disorders, they have a lot of psychostressors, usually more so than the average person. For instance, we're looking at unfinished education because their symptoms don't allow them to finish education, so they may not finish high school or go to college. We're looking at unemployment rates because their symptoms are not allowing them to stay employed. They might get jobs, but then they can't keep their jobs, which leads us to poverty, potential homelessness, incarceration for other behaviors. People who have co-occurring disorders, this population has higher medical problems. They have an increased risk of medical problems. They have poor parental skills. They're less compliant with treatment. They don't follow through with treatment as much as perhaps we might like, perhaps. And they have a greater difficulty accessing the resources. People with co-occurring disorders also have a high prevalence of abuse and trauma histories, and they put themselves in positions to be re-victimized.
So what are maybe some service options for people in Frederick County?
Okay. Well, I work at the Frederick County Behavioral Health Services, which is the leading agency as far as integrated care and support from the state. We have, we are training both our staff. The staff on Shoals Lane and the staff at Montague Lane are trained in both mental health and substance abuse disorders, which is important for effective treatment. If I'm treating a client and I don't understand how their mood disorder impacts their substance abuse disorder, then I may not treat them comprehensively, and their treatment may be seen as failed rather than it just simply did not, give them enough service options.
Well, I think that's probably a really important point. There might be a lot of people out there who have become, I don't know, dissatisfied maybe with prior treatment attempts because they knew that they needed both things to be addressed at the same time, and the system didn't permit it. But I'm glad to hear that your evidence-based medicine now is that you really need
the other thing is that we're really looking at substance abuse as a brain disorder, so, and there's been a lot of different theories about that, but when you look at the brain is an organ that is influenced by the substances that it comes into contact with. And there's evidence that prolonged use of substances impacts the brain in fundamental and lasting ways. People say, well, why can't they just stop when it comes to substance abusers? And they may not have the behavioral choices to stop because the substances are impacting how their brain transmits and receives messages. And so their brain is telling them this substance is as relevant as food. And thus their choices are very limited. So the counselors understand that and can work more with the patients around that. Long-term substance abuse causes emotional, behavioral, cognitive, and intellectual difficulties. Early intervention is imperative with this population. The earlier you are able to intervene with somebody, the better chances you're going to have for treatment and for the outcome.
Yeah, so if somebody out there who's viewing this wants to get more information about where they can maybe either get information or seek services.
If there's somebody out there who believes that maybe they want more information or they or a loved one may have a problem with the co-occurring disorder, I would suggest they call the Frederick County Mental Health Hotline at 211. There's a lot of resources that they can give you there. They can also call the Frederick County Behavioral Health Services at 301-600-1755 and look at getting involved with services there.
Great. Well, Estelle, thank you so much for giving us really valuable information. I hope that some people out there who maybe, weren't quite sure if they should seek treatment or encourage a loved one to seek treatment, I hope that they will, and especially for people who weren't happy with having their conditions separated in treatment before, that now they know that really the evidence-based practice and what we have available at the health department can better meet their needs.
And just two more things, screenings are very important because we can do a very quick screen on somebody, which will then tell us if this person might benefit from a more formal substance abuse or mental health screening or assessment. If somebody's not identified as having these problems, they're not going to be able to be treated correctly.
That's great. I think that's really an important take-home message. So I'm glad that the health department's providing the evidence-based treatment and probably providing the treatment that patients and their family members have probably thought was necessary for a long time. So I'm glad the evidence supports it now, and
it really does.
As well.
It really does.
Great. Thank you very much.
Thank you very much.
And now please stay tuned for this month's Medical Myths. And now here's this month's Medical Myths. Welcome back to this month's Medical Myths. This month's Medical Myths is about heart disease and women. The first myth is that more men than women die from heart disease. Well, that is false. While men do tend to develop heart disease earlier in life than women, after menopause, women catch up. In Frederick County in 2010, slightly more women than men died from heart disease. The second myth is that cancer kills more women than heart disease. Well, heart disease flip-flops with cancer every couple of years as the #1 killer of women in Frederick County. And that's comparing deaths from all types of cancer combined to heart disease. The third myth is that if you think you're having a heart attack, you should sit down and see if it goes away, or you should try coughing. That could be a life-threatening mistake. If you think you're having a heart attack, you should dial 911 immediately, rather than waiting to see if you feel better. Emergency medical services personnel are equipped to treat or resuscitate you if your heart stops en route. And studies have shown that heart attack patients generally receive faster treatment when they're transported by ambulance and the hospital is anticipating their arrival. The fourth myth is that if you don't feel chest pain, you can't have a heart attack. That is false. Although the most common sign of a heart attack is chest pain or discomfort, it's not always one of the symptoms. It is especially important for women to know that other symptoms might include shortness of breath, nausea, sweating, feeling lightheaded, and/or pain or discomfort in other parts of the body such as the back, stomach, neck, or jaw. Men and women alike can experience the Hollywood-style heart attack with severe chest pain, cold sweat, but women, more often than men, have subtler, less recognizable symptoms such as abdominal pain, achiness in the jaw or back, nausea, and shortness of breath. And another common symptom is unusual tiredness. It's that uncanny feeling of fatigue that a woman just can't put her finger on. And too often, women tend to blow off those symptoms. And they might even mistake it for indigestion or a sign of being out of shape. And that mistaking of the symptoms can be deadly. The final myth for today is that heart disease doesn't affect those who are fit and strong. That's false. Staying fit and active does improve heart health, but doctors can cite many cases in which even the healthiest habits are not enough. Exercise does afford benefits, and fitness reduces the potency of risk factors, but it doesn't eliminate them completely. You can perhaps run marathons, but you still have to have your cholesterol checked and your blood pressure, and you still can't smoke. According to the Centers for Disease Control and Prevention, 40% of Americans are at risk for heart disease because of inactivity. 40% due to inactivity. The percentages of U.S. adults with other key risk factors are obesity at 34% of the population, high blood pressure 31%, cigarette smoking 21%, high cholesterol 16%, and diabetes 10%. But remember, 40% of the population is at risk for heart disease due to inactivity alone. So make sure you get your blood pressure and cholesterol checked regularly and follow Angie Blair's health tips related to vigorous exercise and healthy eating. That's this month's Medical Myths. And now here's Angie Blair with this month's health tip.
Hello, this is Angie Blair, health educator with the Frederick County Health Department. Welcome to this month's edition of Health Tips. March is National Colorectal Cancer Awareness Month. Colorectal cancer, which is commonly called colon cancer, affects both men and women of all racial and ethnic groups and is most often found in people aged 50 years or older. Of cancers that affect both men and women, colon cancer is the second leading cancer killer in the United States, but it doesn't have to be. If everybody aged 50 years or older had regular screening tests, as many as 60% of deaths from colon cancer could be prevented. Knowing how colon cancer begins and how to stop it from developing can save your life, and it all starts with screening. Talk to your doctor about your risk of developing colon cancer, as well as preventive measures you can take early on to protect your health. Colon cancer almost always develops from precancerous polyps or abnormal growths in the colon or rectum. Screening tests can find precancerous polyps so that they can be removed before they turn into cancer. Screening tests can also find colon cancer early when treatment works best. The Centers for Disease Control and Prevention recommends that all adults begin regular screening after they turn 50 years of age. However, your doctor may choose to screen earlier if you have a close family member with a history of colon cancer, inflammatory bowel disease, or other hereditary conditions. Work with your doctor to establish how frequently you will need screening for colon cancer. Knowing and addressing your risk factors can help to reduce your chances of developing colon cancer. Consume a diet rich in fruits and vegetables. Avoid excessive weight gain or obesity, and aim for at least 30 minutes of moderate exercise per day. Limiting alcohol consumption and not smoking are also things you can do to reduce chances of developing colon cancer. Here at the Frederick County Health Department, free colon cancer screening tests and services are offered for qualified residents between 50 to 64 and to those under 50 years of age who have a family or personal history of colon cancer. For more information on these services, please contact the Preventive Health Program at 301-600-3362 or visit us online. For more information regarding colon cancer prevention and treatment, please see the CDC's colorectal cancer page. Thank you for tuning in to this month's Health Tip.
And thank you for joining us for this month's edition of Focus on Health. Please join us next month.